All right, so last time we looked at the abductors. Before that, we looked at the extensors and the gluteus maximus and the flexor of the iliopsoas. The abductors, remember, were gluteus medius and TFL, and we also mentioned gluteus minimus briefly. So we're starting to look around the trampoline. Now the next one we're going to add in is going to be the group of the adductors. There's several of them, and instead of going into detail on each one of those, what I want to do is kind of talk about them as a group, because I think as a yoga teacher, that's probably the most helpful thing that you can remember here. So when we look at the adductors as a group, they originate from this whole portion of the pelvis, and you can see here this connection between the pubic bone and this arch of bone that continues back to the ischial tuberosity. So the adductors are going to cover this surface of the bone over the pubic bone and all the way back to the ischial tuberosity. Now, as a group, all except for one of them are going to attach along the shaft of the femur here. There's one very small adductor, the gracilis, that will cross the knee and attach to what we call the pes anserine, which is just this little bony prominence medial, on the medial part of the knee, just below the tibia here. So you can find it if you take your hand to your knee and come to the medial side of the knee, just below the patella. There's a ridge of bone here on the tibia. Remember this main shin bone here. And if I fall off of it, I'm on the pes anserine here, which is right under the medial knee. Not too important to remember that, but it just helps to articulate where you're going here for the gracilis. So only one of the adductors crosses the thigh. In fact, it's a very thin, it's almost like a little measuring tape, right? It's a little thin muscle that crosses both the hip and the knee. But the majority of them are going to go from the pelvis to the thigh bone. So as a group, they're going to be really powerful adductors of the hip. So drawing the leg in toward the midline. Now we'll look at this more when we palpate these, but what's interesting about the adductors is if you palpate on the skin and feel for the adductors, they don't cover a lot of surface area. However, their power comes in the depth here. So imagine, here's my leg. My skin is about here and here, right? The bulk of the adductors comes in all of this depth that they're going from the skin layer all the way into the femur. So here's my femur bone here. It sits in this angling. So all of this from the skin into my femur bone is going to be adductors filling that in. Now the quadriceps are clearly going to overlie that. So a lot of the skin surface area that you palpate here is going to be quadriceps. But the adductors, and you can see this shape in your manual, how it's kind of like a little fan, the fan of the muscle tissue, their power comes from the depth. Their ability to go all the way into the femur bone and to create a really powerful group of muscles that can draw the leg in toward the midline. Again, really important in this trampoline balance that we have muscles on all of these different angles of the hip. We've got the abductors here, the adductors here, the hip flexors here, the hip extensors here. We'll add in the rotators later as well. But we're creating that trampoline effect. So the adductors, again, as a group, their primary action is going to be to draw the leg in toward the midline, adduction. One of the other functions here is to work with the abductors, which we talked about as really that primary stabilizer of the hip, drawing the femur into the socket. The adductors are going to work with the abductors to position the head of the femur in the socket. Think about this. We see this really clearly in something like tree pose. Right, when we're coming into the posture, it's not necessarily just the abductors here, but you can feel as you come into tree pose, there's that resistance of the adductors as I push my foot into my inner thigh and my inner thigh into my foot that works with the abductors to help me position the head of the femur in the socket. Now clearly it's not that the hip's going to dislocate, but that remember, I want that stability so that I'm not laying into those deeper structures of cartilage, labrum, the capsule, the ligament, that I'm really trying to use this community effect of the tissues all working together so that I don't need to overly exaggerate and grip in that support, but that I'm finding that integrity through the community of tissues working together with the passive stabilizers of the joint. So the adductors work as a group, as a kind of an oppositional group to the abductors to help position the hip joint in the socket and create that really important stability of the hip. So if we think about some poses that can strengthen the adductors, a lot of these are fairly subtle. One of the obvious ones we look at is tree pose. But again, clearly it depends on my awareness in the cueing. I can come into tree pose and have very little activity in my adductors here as I lay in the hip joint. Or as I start to cue and bring some awareness into pressing the foot and the inner thigh into each other, I really start to feel the adductors come online and start to do their job. Think about also in something like Warrior B, and I'll face you so you can see this, but the adductors with the external rotators are going to help to juggle the knee position we know is so important for that kneecap to point straight forward. The rotators will start to draw it back, and the adductors start to draw it forward. So we have this balance of articulation of how the kneecap points, which will be different for each person. For some people, they need more of the external rotators to turn on, and for others, they become really tight and maybe need a little bit more of the adductors. But it's that balance to help coordinate and position the kneecap pointing straight forward, which we know is so important for the knee joint itself. Another one, if we come back to when we looked at contractions, another one we can see that's common in our yoga practice to create more of an eccentric contraction is going to be horse stance. Right? So as I come into this, clearly there's some stretching, and again, it will depend on the person. Some people might feel more of a stretch in this pose, and some people might feel more of the engagement and getting tired first. But we do have an eccentric contraction in the adductors. You can clearly feel as you stay here in this pose for a while that the adductors are clearly working. Now, I can also look at modifications. Clearly, the adductors are going to be an important part of this integrity in a lot of our upright postures, working to a low degree, low level tone. But there's a lot of different variations I can use here, even simple things like this leg pushing down into the floor. My adductors are somewhat activated to create that. I could also think about doing little things like lifting this leg. Now these adductors are working to keep my hips level, as well as these adductors working to lift my leg. Now clearly for some students that might not be relevant, and for others it might be really helpful. But I can kind of play with that orientation in space as I start to look at some of these poses and modifications and how the muscles work together. One thing I really recommend as you start to consider some of these different poses and the anatomy within it is just paying attention to what you feel in your own body, in your own practice. Remember that everyone's body is going to be different. Some people are really strong in certain muscles and really weak in others. Some people are really tight in some areas and really flexible in others. So though what you feel may be very different from what someone else in your class feels, your experience is going to be really helpful for guiding what you feel and being able to teach from that. So just noticing when you start to feel the inner thighs getting tired in a class, when you feel them stretching. There's a couple of poses in particular that we feel a pretty clear stretch in the adductors. One would be Upavishta Konasana with the legs spread wide. All right, so this variation. And probably an even better scenario would be to bend the knees in Baddha Konasana. So think about this, and we'll talk about the hamstrings later. But think about this where I'm really probably feeling a little bit more in the hamstrings as I straighten the legs. I can take the hamstring component out of it and really target more of the inner thighs in Baddha Konasana, potentially, as well as I'm probably also going to be feeling some other things, like all of the poses. And really, this is the beauty of yoga, is that none of these are really pure isolations, but it's a coordination of how the body works together. And it really is an individualized experiment to be able to be mindful of what's helpful and how you move and breathe within the experience. So though we're trying to break it down and overly simplify and really separate things, the reality is that each person's experience will be very different. So Baddha Konasana would be kind of the classic one to try and target that stretching of the inner thighs, as well as Upavishta Konasana, though the hamstrings will also be a limitation in Upavishta Konasana. So with the adductors, again, a really important stabilizer, really helpful too. These muscles do tend to be a little bit more similar to some we've already talked about already on the tight and weak side. So a helpful one to look at both stretching and strengthening, and really we could find that balance in any of the muscles. But we talked about the psoas also tending to be tight and weak, as well as the gluteus medius. We talked about the gluteus maximus tending to be more weak, and the TFL tending to be more tight. And remember, these are all just tendencies. The reality is you've got to see what's going on within your body. And really, this is the essence of yoga, is our mindfulness and our awareness that's really crucial to really understanding the anatomy. So that's the adductors as a group. Let's look at the rotators next. So the external rotators in particular. So in your manual, we've got this listed as piriformis and the go-go-Q muscles, which is shorthand for a group of external rotators on the deep layer of the posterior hip. So in general, these muscles are going to be in this kind of horizontal articulation of the muscle fiber orientation, because their job primarily, as I draw these 2 points toward each other, is going to be to contract. And if he didn't have this little pin in him, he'd be able to externally rotate a little bit more. There he goes. To be able to externally rotate the femur. So I go from here to here. Now, the go-go cues. So we've got the go-go cues stand for gemellus superior and inferior. Poor Fred. And obturator internus and externus. And their origins and insertions are a little bit more complex. We also have quadratus femoris, which is a little bit more straightforward, coming down a little bit lower on the sitting bone to the femur. So we're not going to talk about the specifics of their origin and insertion, but I want you to think about them in this general area, creating external rotation. The piriformis is the one that's usually more talked about, more familiar to us. And this one's going to go from this lateral portion of the sacrum to attach to this kind of more posterior part of the femur, the greater trochanter. So when we look at this again, if we think about the piriformis going from here to here, as I contract, it's going to externally rotate. So I see this shortening, external rotation. Now, not to confuse you, but it is helpful to understand as we look at this and we get into the poses that this will change as we start to come into hip flexion. So just watch for a second, and you don't necessarily have to remember this. When we get to the action, you can just trust that I'm telling you the truth if you want. But with this muscle group, the external rotators, they contract to bring us into external rotation. So in order to strengthen these, we'll look at postures that externally rotate the hip. However, when we stretch these muscles, we're also going to look for poses that externally rotate the hip. Because as we come into the stretch, we're going to come into hip flexion, which is going to change the positioning of the femur and that connection, that origin and insertion in relationship to each other. So if you watch for a second, remember, consider the piriformis as our example, going from the lateral edge of the sacrum to the posterior part of the greater trochanter of the femur here. And if you watch how close, the distance of those 2 points to each other, in fact, I'll just use my fingers here. As you watch the orientation of those 2 points, notice that they get further away from each other as I take the hip into flexion, and now my thumb can barely reach where I began here. So even just taking my hip into flexion will stretch these, meaning that maybe I even feel a stretch in something like Paschimottanasana, my straight-legged forward fold. So anytime I bring my leg into flexion, I'm going to feel some lengthening, though you may or may not feel a stretch depending on the relative tension in your hips. Now watch this again. So think about coming into something like some of our classic hip openers, figure 4, right? This is one of the best kind of to start with, where I'm externally rotating and flexing the hip here, right? So I've got those 2 elements happening. So if I consider that figure 4 stretch, watch what happens first. I'm going to do the hip flexion first just so that you can see, even though that's probably not how you're going to come into the pose. Here's the hip flexion. Again, they're getting further apart. Now I'm going to bend the knee and externally rotate, and his screws are stopping me a little bit, but you can see how the greater trochanter starts to go under the hip here and further away from that origin site at the sacrum. So rather than coming into internal rotation to stretch it, which would actually bring this closer, I'm going into external rotation to bring them further apart. I think it's helpful to see that. You might leave this session getting confused about that, but just remember that the external rotator is the only exception to the stretching capacity being the opposite of its action. And really that's just because these 2 points, we're just changing the distance from them as we flex the hip, because as we stretch these rotators, we are flexing the hip, which changes how we stretch it. So, when I look at the piriformis, there's another obstacle that's helpful just to keep in mind. We have the piriformis going this way, and we'll come back to that external rotation in a moment. But if I have the piriformis running in this horizontal trajectory, I also have my friend, the sciatic nerve, that's running right either underneath it, sometimes in a few unfortunate scenarios right through the piriformis, or on top of it. And it kind of depends on the individual. For most of us, it's going to be running underneath the piriformis. Now, many of you might be familiar with the sciatic nerve and this sciatica that can come as an effect of either the sciatic nerve being impinged by the piriformis or something happening in the lower back that's irritating the sciatic nerve as well. So sciatica, remember, is that nerve pain down the back of the leg that's really common. And this can be one issue. Clearly it can come from higher up in the back, but the sciatica, the irritation of the sciatic nerve, oftentimes can come from this compression or this tightening of the piriformis, compressing the sciatic nerve that has to run underneath it. So it can pose a tricky scenario, because if you consider that stretching this muscle also puts tension on it, it can also kind of irritate the nerve a little bit just stretching it. Right? If you can imagine, again, that as I stretch the muscle, I'm pulling it taut to stretch it, which might also put a little bit more pressure on the nerve. So one of the key things here, clearly I want to take the pressure off of the piriformis to ease off that nerve, but I have to be able to do it really gently. So I want to find a mild enough stretch where I can feel some gentle stretch and release of the piriformis without irritating the nerve, which is really clear to feel. Most people who have this pain will know when the nerve is getting irritated when they're feeling that pain. Again, it's a longer topic when we talk about therapeutics, but just planting some seeds to consider that large sciatic nerve, the sciatic nerve is a very thick nerve that runs through the back of the hip, can become irritated from this piriformis. So, another thing to consider before we move into the poses is also that this piriformis and the external rotators can also potentially be an important stabilizing factor, not only for the hip, but the SI joint. But it's a lot like that Goldilocks scenario, again, that we looked at with gluteus maximus, that I want to be able to have enough tone that there's support without creating tension that, again, is compressing and creating irritation in that SI joint, sacrum, even low back. So a lot of that clenching we looked at in the gluteus maximus in the upper portion will be a similar scenario to what we tend to see in the external rotators. That we're looking for a balance of tone and also flexibility so that we're not creating tension and compressing the nerve or creating compression in the SI joint or the sacrum here. So it is an important stabilizer, but I do want that balance of tone and flexibility. So let's talk about poses. With these external rotators, the piriformis and the go-go cues, we have a lot of poses that we see that will actually strengthen these muscles. In fact, there's a whole group of them that we see in our standing poses. Really, if we look at it, any of the poses where we're facing the side of the mat. So if you think of your alignment, when we look at the poses, you've probably heard your teacher cue many times over that you want the front knee facing toward the front of the mat, and you're turning your pelvis and your rib cage toward the side of the mat. Now, the reality is that most people's pelvis won't turn exactly, but I'm turning toward that. Most importantly, keeping the knee forward. So in order to keep that knee forward, we mentioned this a little bit already, my external rotators have to contract to pull what we talk about, pull the hip into the socket and turn the knee forward. So these external rotators are going to be strengthening anytime I have any of these side-facing poses. So warrior B, extended side angle, reverse warrior, triangle pose, I'm still externally rotating here, half moon, all of these postures, the front leg will be strengthening. As I turn the knee straight forward, I'll be strengthening the external rotators. So now the other thing to consider here is how I stretch it. We've talked about this a little bit already. Remember, because of the origin and insertion here, this will be the one exception where I'm going to be stretching it in the same action that I was strengthening it. The only difference is now I'm flexing the hip. So as I stay more upright in my standing poses, it's going to be actively contracting to externally rotate. And as I come to a more passive seat on the ground, where my hips are starting at 90 degrees, it's going to be stretching as I start to come into these externally rotated forward folds. So double pigeon, pigeon, I still have some external rotation in pigeon pose. And the more accessible version of all of that, figure 4. Again, I've got the hip flexion and the external rotation as I stretch the rotators. So I've got a lot of different options there. Remembering with the hips that if I have a tight area, whether that's gluteus medius, piriformis, gluteus maximus, I might feel it in all of those scenarios if it's really especially tight in comparison to the other hip muscles. So the big thing is I just want to find a pose that I can relax into, that's accessible, that I can try and get the tissues to soften in response. So again, we see a muscle where balance is key. The piriformis muscle is, especially in yoga, one that we target a lot, that tends to be fairly strong, but its tendency is to clench and grip. So it's finding that balance of strength and tone, which is an important stabilizing muscle here as well, but also finding that pliability and resiliency within our ability to stretch and release the muscle as well. So external rotators, this deep layer, we'll look at palpation and kind of feeling these different tissues. We looked at the adductors working in conjunction with the abductors, and then the front and back of the gluteus maximus and iliopsoas working together in opposition to create this whole trampoline effect. Next time we come back, we'll look at this exploration of what the tissues feel like, how you experience these tissues in your body and connect to them through this sensation and awareness that we create.